This is Dr. Alok Roy from Medica. Like every week, we bring you the seminar on health is the ultimate wealth. This Saturday, again, we are here with you. And this time, as we all know that Women's Day is very close by, we thought we'll pick up something which is very, very important in the life of 50% of the population of this world. That's a women. With that thought in our mind, we thought that let's talk about the cancer in the women, and especially in the childbearing age. Now, when we thought of it, why did we think of it? Because all cancers are not preventable. Some cancers are preventable, and some cancers, if identified early, are treatable. So the early identification is probably very, very critical. So I have with me Dr. Sudeep, who's our cancer specialist. We call them in our parlance medical oncologist. I did not choose a gynecologist or surgeon. We chose deliberately Dr. Sudeep, who will take you through the various cancers which happen in the women of the age childbearing, and what are the ways to identify them early, treat them so that you can live a life, a good quality life for a long time to come. With this, I hand over to Dr. Sudeep. Sudeep, over to you.
Thank you, sir. Hello, everyone. Myself, Dr. Sudeep Das, consultant medical and hemato-oncologist at Medica Superspecialty Hospital, Kolkata. And so, first of all, thanks to our chairman, sir, for giving me this opportunity. Thanks to Medica Oncology team. So it is a nice initiative from the hospital for raising some awareness among the common people regarding the burning issues, alarming issues of malignancies detected in more and more number in young, reproductively active female Indian population. So, in coming few minutes, I will not go into mind-boggling medical terminologies and make you bored. Rather, I will use simple form of language to raise some awareness among you regarding what are the common cancers in young women in India, how to prevent them, and what are the early detection strategies for those cancers. So I feel very proud to represent this esteemed medical oncology team consisting of various organ-specific oncosurgeons, radiation oncologists, medical oncologists, oncopathologists. And because oncology is a team effort, and being an alumni of Tata Memorial Hospital, Mumbai, this team follow the same principles of cancer management with collaboration with each other, and in most of the time taking decisions after discussions in tumor board. So first, let us discuss why this issue cancer is so important, because cancer is an alarming rise in cancer. Now, non-communicable disease related deaths. Cancer is the second most common cause of non-communicable disease related deaths after the cardiovascular disease. So from this pie chart, you can have an idea that this is second most deadliest disease after cardiovascular disease. So that will give you some idea that why this topic is so important. Now let's see the burden of cancers in our country. Every year, close to 13 lakhs new cancer patients are getting diagnosed. In 2020, there were 13 lakh and 24,000 patients who were diagnosed with cancer, new cases, out of which almost equally 6.5 lakh were male and 6.5 lakh were female. And see the number of cancer deaths. The number of cancer deaths in that year were 8.5 lakhs. So out of 13 lakhs, almost 60 to 70% of the patients they died of cancer. Why? Because the most of the cancers they are getting diagnosed in a very late stage, where cure is unlikely. The intent becomes palliation. But you know, I will give you some a lot of information in coming few minutes, and this will bring some hope that you know many of the cancers are actually curable if these cancers can be diagnosed in very early stage. Now today's focus is women in India, and what are the common cancers among Indian female. So the top 5 common cancers in women in India are breast, most common, then cervix, that is the lower part of the uterus, ovarian cancer, third most common cancers, then head and neck cancers consisting of leaf, oral cavity, and the fifth one is colorectal cancers. But if you go by the volume, breast and cervical cancers, they are actually making the big chunk of the total cancer cases in female population. So I will actually devote most of the time in my presentation on breast and CA cervix cases. Even few years back, cervix was the most common cancers, even 1 decade back. But now, whether you see in the urban population, in rural population, in northern India, in eastern India, in southern India, in everywhere, South India, everywhere, breast cancer is the most common cancer, not only in female, but if you go by the volume of the disease, irrespective of if you go by the all the sexes, then breast is the most common cancers among India. So what is breast cancer? Abnormal cells develop from normal cells in the breast to form tumors. So first they appear just like a lump. Remember, 90% of these breast lumps are benign. They are not always malignant. So they first appear as lump, then start growing inside breast, and from there they tend to spread to armpit, that is we call axilla. And if we neglect, then the tumor from there starts spreading distant sites in body. It can spread to your liver, it can spread to your bones, it can spread to your lungs, or even brain. So my presentation will be touched. I will touch on following points: the burden of the disease, what are the causes of getting breast cancer, how to prevent, early detection, and treatment. Now, first step in dealing with the problem is actually admitting the problem. That yes, to understand what is the burden of this disease. Breast cancer, even few decades back, was a problem of West. 1 in 8 American women will be diagnosed with breast cancer in a lifetime. And 1 in 28 women in India is likely to suffer from breast cancer during her lifetime. But very rapidly, this situation is changing. There are rising numbers of cases of breast cancer in India. There is an age shift. That means that in West, the breast cancer is the disease more prevalent in 50s and 60s. However, in Indian female, breast cancer is noticed 1 decade earlier. That means in the chance of getting breast cancer risk actually starts even as young as when you reach at age of 40. And breast cancer in young population is much aggressive. Their behavior is aggressive compared to the breast cancer in elderly. The breast cancer disease in a 60 years old, in a 70 years old. Compared to that, breast cancer in a young lady of 40 in her 40s, it is very aggressive. And with the Indian, we have a lack of awareness. There is no actually established screening program for breast cancer. We'll see what is screening program in my future, in my upcoming slides. And that's why most of the patients, they present with breast cancer in advanced stage. So see I'm not going into details of these statistics. Just see that in 2020, new cases of breast cancer were close to 2 lakhs in India. And the estimate of projection of new breast cancer cases in 2025 will be almost 2.5 lakh. Is the scenario different in our own West Bengal or Kolkata? No. From this bar, you can clearly see that breast cancer is the most common cancer among female in West Bengal also, followed by the second most common cancer, cervix and ovary. Now, I already mentioned that I will restrict to my discussion on breast and cervix because see that together this breast and cervix, they are actually forming the large number of chunk, the lion's share of the cancer burden is formed by breast and cervix. Now see the trend of more and more young women are getting diagnosed with breast cancer. 25 years back, the blue columns showing 25 years back, the breast cancer incidences were in among young women, like in their 30s or in their 40s, they were short. However, after 25 years, presently, this tall column showing that how the breast cancer is becoming more and more prevalent even in younger generation, like young people who are in their 40s. The problem in our country is that almost 70% of the breast cancer are getting diagnosed in stage 3. Very few, 10% of the patients, they get diagnosed in stage 1. So why this is important? Because if the patient is diagnosed in stage 1, the chance of cure, that is 5-year survival, is close to 100%. So that is the hope I want to share with all of you, that in a stage 1 breast cancer, remember, the chance of cure is 100%. Even if you are getting you get diagnosed in stage 2, the chance of cure is 93%. And in stage 3, the chance is coming down. The cure is 72%. These days, we have advanced a lot. We have a lot of systemic options, systemic therapy options, a lot of chemotherapeutic options. Not only that, with different hormonal medicines, different targeted therapy, immunotherapies, by which even a stage 4 metastatic breast cancer can enjoy a life of 5 years. The chance of living for 5 years is 22%, even in stage 4. So from this figure, it is it's very evident that the success of breast cancer management mostly depends on the which stage you are actually getting diagnosed. So for that, we need to understand that what are the risk factors of breast cancer. Now, some of these risk factors are not preventable, and some of the risk factors are preventable. Now, the first, being a woman, you are always at risk of getting breast cancer, which is not preventable. Then age. As you grow older, the chance of getting breast cancer actually high. Breast cancer is the lifetime risks. If you distribute the risk of breast cancer in different decades, when you are growing in your 60s or 70s, getting breast cancer is more likely. But you can't prevent that. Then there are some association with race, like breast cancer is more prevalent in white Western people than the black African. Now coming to family or personal history. If there is history of breast cancer or other gynecological cancer like ovarian cancer or uterine endometrial cancer in your family, family means in first degree relative like in mother, in siblings, or second degree relatives like grandmother or cousin, then there is a higher chance of getting breast cancer. So there is a question here often asked to with the oncologists that, sir, that means two of my relatives, they had breast cancer. So that means that is that hereditary breast cancer? No. If there is a history of familial, there is history of breast cancer in your family, of course, you have some more chance of getting breast cancer, but that does not mean that you are inherited the breast cancer associated genes. Only 10% of the breast cancers are actually inherited from your parents, which are BRCA1 and BRCA2 associated breast cancers. Now, the other important risk factors for breast cancers are mostly reproductive history. That means most of the breast cancers, they are because of overexposure to female hormone estrogen. So if the longer is the exposure to estrogen, the high is the risk. So if your menstruation starts early, as early as before 9 years, or there is a delayed menopause, that means the menopause is above 55 years, that means for longer duration you are exposed to estrogen, then the chance of getting breast cancer is high. Other factors which are associated with breast cancer is nulliparity, that means not having children. So any female who is during their pregnancy period, they are exposed to actually progesterone, and progesterone is actually helpful for for breast cancer, and it is the estrogen which is actually responsible for breast cancer. So not having children or having the first child in very old age, that is more than 35 years old, these are the risk factors for breast cancer. Radiation is one of the known factors for breast cancer. Anyone who gets radiation treatment during their childhood, maybe because of Hodgkin's lymphoma or some other reasons, they are actually at more risk for getting breast cancer. Now, what are the factors which can be prevented? So first, obesity. Overweight is one of the risk factor for breast cancer development. Not only breast cancer development, the breast cancer survivors who successfully got treated, got cured from the disease, we very often who are on regular follow-up in our clinic, very often we advise them to control their weight, because it is seen that if the higher is the weight, there is a higher chance of recurrence of breast cancer. So control your weight, exercise regularly, avoid alcohol, avoid junk food or more and more animal food. These are the steps you can follow in your life to get to actually to reduce the chance of getting breast cancer in your lifetime. Then I already mentioned a few minutes back that not having children actually, or having the first children at a very older age, these are the situations which will actually increase the risk of breast cancer. Birth control pills, OCP pills, use of those pills for more than 5 years, they increase the risk. Hormone replacement therapy, only estrogen containing hormone replacement therapy, they are risk factors for breast cancer development. And it is also shown in some different data that smoking is also maybe associated with breast cancer development. Now, what are the signs and symptoms of breast cancer? Because our ultimate aim is to first to prevent them, and if at all the breast cancer is already getting diagnosed, then we need to diagnose them in very early stage. The most common presentation of breast cancer is a lump or a thickening in your breast. And please remember, I stress here, I give more stress here, these lump or thickening in your breast at the beginning, most of the time they are painless. So very often our patients, they ignore this lump in breast. They feel that those lumps were not painful. That's why they did not pay any attention to those lumps. Most of the breast lumps are actually, to start with, are painless. Then they start growing in size. Often you can also feel a lump in your armpit, which we call axilla. There can be a discoloration or changes in the breast skin. That means there can be a redness over your breast skin. There can be a dimpling, that means indentation on your breast skin. There can be skin can be irregular or puckered. There can be scaling of the skin. One of the common presentation of breast cancer is nipple retraction. That means nipple is directed inwards. It is one of the common presentation of breast cancer. And discharge from nipple. Most of the time, blood stain discharge from nipple. So I love this picture. From these oranges, we can explain every form of breast cancer symptoms. So what are the common symptoms, common signs? Thick mass or indentation. See, there is a deepening here, or some skin erosions, redness or heat, that means warm skin, some discharge from your nipple, dimpling on your skin, a bump or growing veins, or retracted nipples, or new shape or size of your breast, or orange peel skin. The skin over your breast is, there are so many small indentations which ultimately makes the breast skin look like a orange peel, which we call in medical term pubic orange sign. So these are the common signs and symptoms of breast cancer. Now, an ounce of prevention is worth a pound of cure, which is a very famous statement from Benjamin Franklin. And we are interested now to learn How to prevent? First of all, keep healthy body weight. Exercise regularly. Not only breast cancer, the this junk food, animal food, extra calorie, processed food. If the food products were honestly labeled what we are consuming these days, probably this could be the picture. Restrict your junk food, animal fat food, and processed food. Take healthy diet. That means take a lot of green leafy vegetables, fruits, seasonal fruits. Avoid or limit alcohol. Alcohol is not only it causes breast cancer, it is the reason for almost 7 kinds of cancers, starting from mouth and upper throat for larynx, esophagus, liver, colon cancer. It can cause so many cancers in different organs in your body. So please try to avoid and limit alcohol. Please know that breastfeeding reduces the risk of breast cancer. So actually breastfeeding is helpful. So that's why at even few decades back, Indian women, in Indian women, breast cancer was not that prevalent. Probably because of the more and more urbanization and westernization of our society. So breastfeeding, a lot of urban women, they avoid breastfeeding, and that's why they are actually prone to breast cancer. The risk goes high. Now there is another strategy to detect breast cancer in very early stage, where the chance of cure is as high as 100%. We call it screening test. Screening test means doing some simple test or investigation or clinical examination by which you can detect cancer in asymptomatic healthy people. Please remember, screening is done in asymptomatic healthy people. Screening is not done in a patient who is symptomatic and who is coming to OPD with a complaint of symptoms. So screening is for mass, for people, common people. So what are the 3 steps? Breast self-examination, clinical breast examination, and mammography. So let's see. Breast self-examination means the guideline is that any woman, they should um, examine their breast once a month, routinely, starting from their age of 20. Clinical breast examination, the guideline says from 30, they should consult any physician for clinical breast examination every 1 to 3 years. And the guideline, most of the guidelines says that mammography should be done annually, once in a year after the age of 40. So what is, I will go into detail of these 3 steps: breast health examination, clinical breast examination, and mammogram. Breast self-examination performed at the same time every month. Check for changes in your breast, first by observation and then by palpation. First, start with standing position while you are taking shower, or you stand in front of mirror, and then you lie down and you palpate your breast. So these are the 5 steps of breast self-examination. Step 1, examine your breast in the shower. Step 2, examine your breast in the mirror with your arms first down, then up, and then on your hips. Stand and press your fingers on your breast, working around the breast in a circular direction. Lie down and repeat the step 3. Finally, squeeze your nipples to check for discharge. Check under the nipple last. This is mammography. What is mammography? Mammography is specialized X-ray of breast. So mammography should be done in any healthy female once they reach 40 annually. And below the age of 40, actually the breast tissue is so dense that mammogram is not a good modality. Then we suggest ultrasound for screening. Now, see the success of the beauty of this test mammograph, that uh, when female who is occasionally doing breast self examination, this is the tumor size, average tumor size lump found by women. If she is undergoing regular breast self examination, then the average size she can pick up even a smaller size. Single mammogram in her lifetime can pick up this small tumor size. And a regular mammogram, yearly regular mammogram starting from 40, you can pick up a very small tumor, which is even less than 1 centimeter, and you can't palpate that. Most of the time, even good experienced clinician can't palpate the tumor in breast tissue, but mammogram can pick up. And this mammogram test is just an X-ray of breast. It is done on OPD procedure. It is non-invasive. It is easily available in most of the city hospitals, and it is available. This facility is available in Medica Superspecialty Hospital also, and it costs nothing. So I strongly recommend all my viewers, please undergo mammogram once you reach 40. So there are some myths and frequently asked questions about breast cancer. Yes, being overweight in postmenopausal status increases your risk. Healthy diet and exercise can reduce your risk. Drinking alcohol, of course, increases the risk. No, large breasts do not increase your risk. Yes, using birth control pills for more than 5 years increases the risk. Now, there are some myths. That myth is breast cancer is always a hereditary disease. No, I told you that 90% of the time it is a sporadic disease. Only 10% time it is breast cancer is hereditary disease. And second, there is a false belief that biopsy causes dissemination of cancer. No, this is not fact. Biopsy does not cause dissemination of cancer. In fact, biopsy is compulsory and very much essential for correct treatment. Third, FNAC is as good as true cut biopsy. No, these days the breast cancer treatment depends on molecular typing of the breast cancer, not the all breast cancer biologically they are same. So to characterize the molecular type of the breast cancer, you need tissue. Biopsy is compulsory, not FNAC is not good enough. For treatment of breast cancer means always mastectomy, sacrifice of the whole breast. No. If the tumor size is small, you can save your breast. Only a part of your breast can be removed, which we call breast conservation therapy, without compromising the final outcome survival. Finally, patients with breast cancer cannot conceive. No, they can also conceive, they can also live a regular life. Now, next, I will move to second most common cancer in Indian female, that is cervix cancer. What are the symptoms of cervix cancer? Unusual pervaginal bleeding. It can be between two menstrual cycles. It can be during intercourse, which we call postcoital bleeding. Even it can be a postmenopausal PV bleeding. There can be vaginal discharge, like foul smelling, watery or brownish discharge. And in advanced stage, patient can also complain with pelvic pain, abdominal pain, and there are some constitutional symptoms for cancer which holds true for all solid malignancies, like fatigue, loss of appetite, lethargy. These are the signs of almost all solid malignancies. Please remember, more than 90% of the cervical cancers are actually preventable, because this more than 90% of the cervix cancer is actually because of infection from a virus, which is human papilloma virus. So from this simple diagram, you can understand that human papilloma virus infection of your urogenital tract is actually responsible for 90% of your cervix cancer, 90% of the cases of anal canal cancer. Anal canal is the last part of your rectum, and some it is most common cause of your external genitalia cancer like vaginal cancer, vulval cancer. Not only that, human papilloma virus is responsible for 60% of penile cancer in male, and it can also cause oropharyngeal cancer, that means cancer of tonsil, because of altered sexual habit. So now you can understand that what are the causes of can be the possible causes of cervical cancer. That means persistent HPV infection, and early marriage and early pregnancy, multiple children, early onset of sexual activity. That means you got infected with HPV in a very early age. So getting CS cervix, the lifetime risk goes high, and poor genital hygiene. So cervical cancer is preventable, and the secret actually is hidden inside the statement that when more than 90% of CS cervix is caused by this human papilloma virus. So adopt safe sex practices, avoid sexual practices with sexual activities with multiple partners, use barrier contraceptive like condom. Treatment of reproductive tract infection actually reduces the chance of getting CS cervix. And finally, HPV vaccine. We have a vaccine for this deadly virus. So there are two commercially available vaccines available in India. One is Cervarix, another is Gardas. And their effectiveness is close to 100%. So these are the important steps of CS cervix prevention. First, safe sexual habits, practices. Second, vaccination. Now, once the cervix is infected with HPV because of sexual intercourse, the virus is already there. So we need to vaccinate the people before they are sexually active. So that is why most of the recommendations they say that the vaccination should start from 9 to 14 years of age, adolescent female, before they are actually sexually active. The target population is 12. 2 doses is enough if we give them below 14 years at 0 months and a second dose at 6 months. Second strategy for CS cervix prevention is pap smear. Pap smear is a very simple test. It takes few minutes to just take a sample. It is just a this is painless, non-invasive procedure, and what we do, we actually just actually take the touch imprint of the cervix and get a sample from your cervix. And most of the foreign countries, they recommend starting pap smear test every 3 years, starting from the age of 21 years. But in our country, there is no established, no clear-cut screening guideline. So because of logistics issues, ICMR recommendation is to start pap smear screening for cervix after age of 30 years. And it should be done once every 3 years. However, this is not a 100% sensitive test, so we can miss some of the cases. So if we can also test the people for HPV infection after 30 years, then even we can prolong the frequency of our screening test for every 5 years. This is a very important slide. Please go through the data that the chance of cure in stage 1 CA cervix is as high as 95%. Stage 2 CA cervix, 70% of the patient they get cured. Even in stage 3, they get cured in 40% of the cases of stage 3, they get cured. So that is the importance of diagnosing these cancers in very early stage. So screening is one of the best strategy to diagnose this CS cervix in very early stage, in curable stage. So my appeal to all my viewers will be that please, if you are above 30, consult gynecologist and get pap smear done, screening test done once in every 3 years. You know, in India, we have in 2022, we have all the technologies. We have all the linear accelerator, radiotherapy machines, gamma knife, X knife. We have all skilled surgeons, world-class internationally acclaimed surgeons. We have all the latest medicines available in Indian market, all sort of chemotherapies, targeted therapies, immunotherapies, whichever is available in West is available today in Indian market. But you know, what is lacking here, that is spreading the awareness is the key. Because I told you that 70% of our breast cancer patients are getting diagnosed in stage 3, where the figures are actually reversed in US, in Europe, where 70% are getting diagnosed in stage 1 and stage 2. That's why their success is story is different from us. And that's why we have a lot to do with the physicians, with even the common people, by spreading the message, the awareness among the common people. So thank you for patiently listening me.
Thank you, Dr. Sudeep. I think you have very, very nicely elucidated. And as he has brought out, that one of the biggest cancer in majority is breast cancer, followed by cervical cancer. And then the ovarian cancer. He did not cover ovarian cancer because he said that let's look at those which can be early identified and can prevent it. He brought out very clearly that there was a time when the disease used to happen to the elderly population 50 and 60. Now they are moving down to 40s and 50s. And he also said that those youngsters who are getting the disease tends to be more aggressive as compared to the older generation. He said you can't avoid your gender. That's in itself is a big risk. But he pointed out that if you do a proper self-examination, then a lot can be identified and you can present it. And he also said that because if we identify in stage 1, then almost 100% survival rate, which is a huge conviction and comfort we have. He said that tumors. Now, a couple of questions I have from Dr. Sudeep Das is that what do you mean by tumor? You said 90% tumors are benign. In our mind, in common man's mind, 90% tumor means that there's a cancer. So you said no, 90% are not cancerous. Can you define between tumor and cancer? Can you just explain the relationship?
Yes, sir. Sir, tumor is actually a collection of cells, which are, well, they are abnormal cells, but they are not proliferating in such rate that they can spread to some distant site. So like fibroadenoma. So most of the tumors of breast are actually diagnosed as fibroadenoma. These are benign tumors. They are not cancer. Cancer means that the cells there are proliferating at a very faster rate, and they can spread from their origin to distant sites, and those cells are so much deviated from their original source, that they are not actually doing the actions which they were supposed to perform in body. Suppose a tumor is growing in breast, that means it is originating from ductal cells. So they'll start losing all the characteristics of breast ductal cells. Now they are no more normal breast ductal cells. So they have transformed from normal ductal cells, and they were designed for some particular function to do in any organ, but they don't do those functions, and they stop doing the original functions which they were supposed to do. And rather, they grow very fast, and they start even migrating from that place to different place, either via blood route or by lymphatics. So that
So,
is,
Dr. Das, if I understand you correctly, tumors mean just a swelling. For a
this is
common
why.
man, for all my
Yes.
listeners, the
Yes.
tumor is just a swelling. That does
Yes.
not mean it's a cancerous.
Yes, sir. Yes.
So, Dr. Das has explained that because cells lose their natural identity, so they become very aggressive and they tend to go everywhere. So, tumor means that there is a swelling and 90% of it is benign. He brought out very clearly that estrogen is the hormone responsible. You all know, every woman knows estrogen and progesterone. Estrogen, which is in abundance during the first half of your cycle, and progesterone, which comes in the second half of the cycle. Progesterone is protective, and the estrogen is destructive when it comes to breast cancer. In relation to breast cancer, otherwise, without estrogen, we can't produce children. So it's a very important hormone, but because in patients, in people whom it appears early, those young children who get the periods, we call it menarche early, and those who end it late, they are exposed to estrogen for a long time. So now you know, in your mind you can find out about yourself, listeners, that at what age you started, and so you are predisposed probably more than others to get the cancer. As he said that 26% of the cancers are breast cancer in women. And he also said that though we are fortunate that it is more in American women than in Indian women, but he also pointed out that in American women, because their awareness is very high, they identified much earlier. So they get treated earlier, and their survival rates are far better than Indian women. So I think it's time for us to create more awareness. Share this with your friends across. He also said that some of the preventable causes he brought out is obesity, exercise, breastfeeding, avoid alcohol, then birth control pills, hormone replacement therapy. Dr. Das, there's a question asked on the chat that those ladies who couldn't feed their children in first few days of the children's birth, maybe 10 days, 20 days, and then they start feeding them. So are they reasonably protected, or they have lost out on cancer prevention therapy?
They are reasonably okay. Still, they will enjoy the protective good effect of breastfeeding. They will have the benefits, sir.
Fantastic. So he pointed out very clearly that those women who have breastfed or breastfeed, they are kind of protected from breast cancer, and that's a huge impetus to the breastfeeding. I think the breastfeeding should be done, and it saves the womanhood from a lot of other problems as well. He pointed out that how the breast examination should be done. He said that, if I heard correctly, that if you do it once in a while, occasionally, you can identify a size. But if you are doing it regularly, you can bring it down to the bare smallest level. So that means that anybody above 20 must do their breast examination, lying down, standing, you can do in shower, while lying down the bed. So on a fixed date, he said, if you do it every kind of now and then there are, because of the variations in the cycle, The breast may appear different at different times in the cycle. So he pointed out, do at a fixed time, fixed date, and then your cycle may keep on changing, but the fixed date will give you a comfort, and a regular examination will train your own hands. And also that it may not be a bad idea to do your mammogram regularly, because mammogram can really pick up the smaller size. Nowadays, we have got a fantastic machine in in almost all our hospitals. We have got a digital mammography machine which can pick up before the cancer start imagining, mammography can pick it up. It's as sensitive as that. So, and that means that stage 1 and 100% survival. Imagine that lifelong survival as it's just small precautions here and there. He also said one thing which is very profound, though he spoke in a very, very medical language, FNAC and true cut. FNAC is fine needle aspiration cytology, where you put a needle inside the tumor and suck the fluid out and examine it. That is not true biopsy. He said true cut biopsy, where we put a thicker needle and take the tissue out, because we have to do a lot of molecular staging of the cancer. Cancer is no more structural changes. Cancer depends a lot on the hormone, which has been triggered by a hormone, has got a hormonal-like quality. So it can be manipulated by giving different drugs. And its sensitivity can be assessed by knowing that it's a molecular fingerprinting, molecular pattern. So they have got very lot of advanced medicines. Science is truly advanced now, and make use of it by being a little bit aware, a little bit conscious of what you are doing in life. It will save your life. It will save your family's life. So teach your children, teach your girls, teach your daughter-in-law, teach your sister, teach your mother, teach everybody. You should become ambassador of us in taking this knowledge to your people, because that will save your life and a good family. Then he brought us down to the cervical cancer. I'm sorry, I'll just take one more minute, though our time is up. That he said that cervical cancer is completely preventable. It's fully preventable. He said that it is because of HPV virus. Virus induces cancer, and virus creates cancer, virus progresses the cancer. So if we can identify it in stage 1, where the first symptom appears, first signs appear, the life is 100% curable. From there to 22%. So it is practically your life is in your hand. All my women friends who are listening to us, please remember, your life is in your hand. So much of it. You all have heard about Angelina Jolie. He mentioned about a BRCA's kind of genes, which made her 85% sensitive to getting breast cancer, and she got her both breasts removed. That's the level of awareness Western world have. There's no reason why our Indian women should not have it. Please be very alert about cervical cancer. Any spotting happening midterm in postmenopausal, postcoital after sex, or just like that blood appearing, needs to be taken with caution. Do your pap smear regularly from a good center, good place where they do pap smear properly is very, very important. And he's talked about vaccine. I don't know how convinced you are, but trust me, if there's one vaccine which our younger women should take, is HPV vaccine. It's a lifelong guaranteed for not getting cervical cancer. Today, when I find youngsters giving their cord blood, preserving it, and they're doing all that for our young children, one vaccine will save them from lifetime of precaution. So I think we are overrun the timing, but Dr. Das, thank you very much for really bringing out both to a very sensitive topic very well. I'm thankful to my partners, Bengal Chamber of Commerce and Industries, and the Rotary Club of Calcutta, Vienna, for taking the message to your partners, your stakeholders, and please stay associated with us every week, every Saturday, 5:30 to 6:30. We bring some new thing for you, and we want you to stay healthy. And we want to give the right to stay healthy in your hands. And that is the reason why we create this webinar, Health is the Ultimate Wealth. Thank you very much. Have a nice weekend, and we'll come back to you again next Saturday. Thank you.
Thank you.
Thank you, Sudeep. Thank you, ITT. Bye.
नमस्कार, मैं हूं आलोक जोशी और आप देख रहे हैं माइंड योर बिजनेस। माइंड योर बिजनेस में हम बात करते हैं अर्थव्यवस्था की, कारोबार की, लेन देन की, अपनी जेब की। इस वक्त हालात ऐसे हो गए हैं कि जिसमें ये मसले समझना जरा मुश्किल हो रहा है। एक तरफ बाजार भर में चर्चा है, दुनिया भर में चर्चा है कि अमेरिका में मंदी आ रही है। तो अमेरिका में मंदी आ रही है कि नहीं आ रही है, अपने आप में एक बड़ा सवाल है। हालांकि ज्यादातर जानकार अब इस बात पे एकमत होते जा रहे हैं कि मंदी तो आ रही है, लेकिन आ रही है तो वो कितनी गंभीर होगी, कितना परेशान करेगी, ये सवाल है। क्या दुनिया भर में फैलेगी ये बीमारी, ये सवाल है। और अगर ये हुआ तो फिर बचेगा भारत। पिछली मंदियों में ऐसा हुआ है कि दुनिया भर में मंदी आई, ये जो मुद्रा संकट आया था उसमें भी भारत बच